Hi, everyone. It's great to have you here. I'm Teresa Youngkin, and I'm passionate about helping healthcare leaders stay ahead of the curve when it comes to new technologies by simplifying IT concepts in a business oriented language. So, whether you're struggling with data initiatives, trying to make informed decisions about new technologies, or dealing with the constant changes in the market, we've got you covered. As an experienced health informaticist, I'm thrilled to guide you through the journey of understanding the advantages of data interoperability, supporting clinical decision support systems today. Now, let's dive right in. Picture this, and I'm sure that you've heard the stories. You're a busy medical professional, you're running from one patient to another, you're juggling multiple cases and trying to make the best decisions for your patients. But what if I told you that there's a way to have your very own sidekick to support your clinical decision making process? Enter data interoperability and clinical decision support systems, or CDS. Data interoperability refers to the seamless exchange and the use of healthcare data across different systems. It's like having a universal translator that ensures different healthcare software and devices can understand and work together harmoniously for the benefit of the patient and the provider. Think of it as a digital language that allows your patient data to travel freely between systems. And we've talked about all kinds of different data standards. One of them is FHIR, and using these data standards will save you and your organization, including your providers, precious time and effort. Now, let's talk about the dynamic duo data interoperability and clinical decision support systems. CDS are like your trusty sidekick, right? They provide you evidence based insights, alerts, and recommendations right at your fingertips when you're a provider. That means giving you information at the point of care when you're in the room with the patient so you can have a discussion and engage your patient in some of this clinical decision making for themselves. CDS leverages the power of data interoperability to access relevant patient information from various sources, such as electronic health records, lab results, and research databases. It's important to have research databases involved. Why? It's because there's so much research going on. The volume and the veracity of the data coming out is so hard for anybody to process. It's nice to have some sort of technology that's been vetted by your organization and by your colleges to say this in evidence and in research is shown to provide the best outcomes for your patients. Well, you know, when you have all three of those together, you can analyze the data that is brought to you with timely and accurate guidance when you're trying to make clinical decisions. And why is this important? Well, studies have shown that clinical decision support can significantly improve patient outcomes, reduce medical errors, and enhance the overall quality of care. Now, if you want some weight, I'm gonna talk about some referenced and published regulations that support the use of clinical decision support. You know what? I do think that interoperability and clinical decision support really are a dynamic duo. For instance, okay, so the Center for Medicare and Medicaid Services, or CMS, as we call it here in the US, has recognized the value of having clinical decision support in improving patient safety. In their regs, they encourage the use of clinical decision support to assist healthcare professionals in making well informed decisions and enhancing the quality of the care that they provide. It's like having an extra set of eyes that guides you towards the best treatment options and ensuring that you have patient safety. And I have to say, right, the best treatment, quality treatment, and patient safety are top of mind for every clinical provider. Furthermore, numerous successful demonstration projects have showcased the positive impact of data interoperability supporting the use of clinical decision support. Projects like the Partnership for Patients initiative has implemented clinical decision support tools to reduce hospital readmissions, enhance medication management, and improve care coordination. You can go out and look at other research agencies like ARC to find more studies around this. You can just Google improvements using clinical decision support and get numerous amounts of information and details and real world examples of how you could implement clinical decision support and data interoperability together in programs to provide the benefit, the value, and the efficiencies that you're looking for your providers and what providers are looking for technology to do for them. Well, these real world examples demonstrate the transformative potential of this dynamic duo in delivering better patient care and achieving healthcare quality goals, right? Part of everybody's strategic plan. And one thing that we don't talk about is when you have clinical decision support that is supported by evidence based medicine that has been vetted for inherent bias, well, then you start to level out the playing field for everybody when it comes to health equity. Now, having fire named in regulations has opened the door to numerous apps being developed. So, I talk about this all the time. I'm pretty knowledgeable because my team has recently launched a lupus app using fire to help physicians document the severity of lupus in their patients. Lupus is considered the great imitator. So, having good quality evidence based college, the American College of Rheumatology endorsed treatment guidelines are very important to provide care to lupus patients. Well, by midsummer, there's going to be another app supporting providers and their patients by automating the tasks of enrolling patients into patient assistance programs for costly and sometimes cost prohibitive drugs that result in some patients not being able to afford the benefit of these treatments that are available in the market. Again, how do we create health equity? We start by making decisions at the point of care, talking to the patients, involving them in the decision making, and also being able to have relevant information at the time of care, right when you're there, so that you can also make good decisions on behalf of your patient. Nothing better. So, in conclusion, the advantages of having data interoperability supporting your clinical decision support systems are profound. They offer you a valuable companion in any provider's medical journey. They provide evidence based insights and they provide recommendations to enhance your decision making process. And by leveraging the power of data interoperability, clinical decision support can revolutionize patient care, improve outcomes, and contribute to the ultimate goal of delivering exceptional healthcare. And if it hasn't been proven yet, you know what? It wouldn't be in regulations and we wouldn't be talking about it. So, let's embrace this digital partnership. Let's harness the potential of data interoperability and clinical decision support and embark on a journey where technology becomes our trusted ally in the pursuit of better patient care. Together, we can conquer the challenges of healthcare and ensure a beautiful, brighter, healthier future for all. Now, if you want to learn more about how your organization can develop a comprehensive strategy to promote data interoperability, data quality, and presenting these great amounts of information to your providers, to your end users, be it provider or patient, I invite you to book a call to discuss how we can work together to develop a customized interoperability strategy that's designed specifically for your organization because we are not one size fit all. All right. Thank you guys for joining me. I really do appreciate you guys being here every week with me, driving forward, improving healthcare for both patients, providers, and everybody else in the ecosystem. All right. We'll catch you here again next week. See ya.